Today in our pet specialist segment, we are talking about eye issues for our pets and eyelid issues in particular. Dr. Jerome Williams, regular guest with us here on Good Day Alabama, and Dr. Jana Korsch-Dismukes here today with...
This is Stella.
Hey, Stella. How are you today?
I'm doing well, thank
Good.
you.
Good to see you. So, talk about Stella and in context of what we were talking about today with eyes.
Well, so Stella is a very special patient. Her eyelids are actually fine. She is a cataract patient of mine. So Boston Terriers are one of many breeds that get hereditary cataracts. And so I performed cataract surgery on her. And
she seems to be doing okay.
She's friends with my own little Boston, Libby Lou. So
y'all can probably hear her breathing. They are so funny. They're a little smushed face. Okay, so you see stuff like this, you would send her to somebody?
Yes, we send to a specialist, a veterinary ophthalmologist like Dr. Jana, and she does those things that those of us as general practitioners cannot do. And she's brought some eyelid issues that she has addressed with her today.
Okay, well, talk about what do we see with our pets?
So a lot of animals that we end up doing surgery on have either an eyelid defect that may be...
oh my gosh, okay, what are we looking at here?
So that sweet little poodle is has a congenital abnormality. It's called a choristoma or dermoid. It's where there's a patch of hair or fur in this case that's growing in the wrong place on the eyeball. So
now, does this happen over time, or are they born with something like this?
They're born with that. So it's congenital. They're born with it.
Goodness.
And so she had constant eye infections and obviously irritation. So that was surgically removed, and I had to reconstruct the eyelid margin.
So you get tumors on the eyelid, and the thing I see most often is entropion, where the eyelids are actually rubbing in against the eye.
Right, so entropion, ectropion, where the eyelids are either too long or they curl in, allowing the eyelashes and hair to rub on the surface of the eyes. It's very uncomfortable for the dog or cat.
So can you not know it's going on until something starts to get
problem?
bad? Yeah.
Sometimes it's obvious, like in an eyelid tumor. You know, there's a lump or a red spot that gets bigger and bigger, and the pet may not complain about it, but in general, with eyelid tumors, you know, the rule is earlier is better
obviously a cat
than
here.
later. So this kitty, as you can see, has an extensive eyelid tumor that needed resection, and actually had to reconstruct the eyelid and create a new eyelid.
So that's on the right. That's the finished.
That's on the day of suture removal.
Wow.
So,
That's amazing, doctor.
Isn't it?
in the end, she really didn't have any scarring. And was able to blink, and that's probably the most important thing, that that the result ends up in a functional eyelid, so that, you know, the globe is protected.
So for pet owners, what do you suggest? Do you go see your primary veterinarian first, and then be recommended?
So if there's anything that looks abnormal to you, asymmetry between the two eyes, squinting, excess tearing, go to your veterinarian, and they'll take a look at it, and if it's something that they think needs to come to me,
then they'll come to you.
Then they'll say, you need to go visit the ophthalmologist.
And if these issues are not addressed, many times you can lose sight or lose that eyeball from the rubbing.
Thank you both. Very important stuff. And thank you.